may have, of course, breathed a sigh of relief because of the lifting of mask mandates. However, there's a new COVID-19 subvariant in town, and it's called Centaurus. Virologists warn it's extremely transmissible with the potential of causing even more severe disease. So let's get some insight on this with Higher Health CEO and health expert, Professor Ramneek Ahluwalia. Prof, always a pleasure talking to you. Thank you so much for making time for this conversation this morning. I'm sure it's not the news that South Africans want to wake up to, but it is a reality. There might be concerns of a new subvariant in town. Absolutely.
First of all, Centaurus is a wrong name. Actually, the variant is BA 2.75. It's still from the family of a variant of concern called Omicron, and it's a subvariant. So WHO does not give names to subvariants. It usually gives names to the variants. So first of all, it's a misnomer, but BA 2.75, and you're right, it's in the town. Now, it's from the same family of Omicron. And so it's a subvariant of Omicron. The other thing is this virus is continuously trying to do three things. It's a very mutating virus. And this is expected. It was expected that the virus will keep on changing its shape, it's called mutations. And three things are: one, it's going to always try to become more transmissible, which means it can easily spread from one human to the other, because that's the only way it can survive, because it loves human body and that's where it enjoys its food and bread and butter. The second thing is it tries to evade our immune system, whether it's a vaccine or a natural immunity. It wants to evade and tries to change its spike proteins or shape, which we call as mutations, so that it can live longer in our body. It can survive in our human body, because our immune system will kill it. That's why it wants to evade. And the third thing is, because the first two things happen, it changes its clinical patterns, which means our human body responds to this virus differently, which means we show different clinical patterns, so not the same like in every time we see. However, when we talk about BA 2.75, South Africa experienced a blip called a fifth wave just in April and May, which we saw because of a subvariant called BA.5, which means our immune system, and this is just a prediction and we still believe, our immune system should be very strong enough and should be there in order to tackle BA 2.75, which means the infection still should remain only mild, and reinfections are possible, but not to the level of severity that we've seen with the previous say the variant of Omicron when it caused the fourth wave, or even the previous deadly waves that we saw.
Right. So with that being said, even though, Doc, you just mentioned, thank you so much for the clarity around the name of the subvariant, BA 2.75. Now that we are no longer mandated to wear masks, it's not compulsory anymore to wear masks. And even though you've alleviated some concerns to say it may not necessarily cause severe disease, what does it mean with the non-wearing of masks? Should we go back to wearing masks? What's your advice here with this new subvariant now in town?
See, COVID has been a deadly virus. It's killed so many millions and millions of people globally, and it still continues to do so. If you look at the data of South Africa or the global data of deaths, it's not like it's completely come down to zero. It's happening on a daily basis. The virus is around us and it's mutating. As I said, it's a very mutating. Plus, it's an airborne disease. So the complication of dealing with such a pandemic is always very high. So people who are living with comorbidities, people who are still elderly, people who are at risk, as we have always defined in 2.5 years of data that remains with us on this COVID-19. And should you find yourself in an indoor, closed congregation, less ventilated, wear a mask, because that's the best preventative measure we have. The other issue is get vaccinated. I mean, people who are not vaccinated, please remember this virus is continuously trying to evade the immune system. It's continuously trying to be more transmissible. This is a mutating virus. Vaccines will boost your immune system to fight and not let you get into a severe disease. What we want to avoid is fatality. Mild infections we might not be able to avoid because it has a high potential of reinfection. But what we can definitely avoid is severe infection, which is fatality and deaths. And booster dose. When you are due, go for it. Because when your natural immune system or vaccine immune system falls down with does with time. This is a natural phenomena. The booster brings your immune system back and helps you fight. So I think this is critical, and I do advocate masks for people who are high risk, people who are elderly, with comorbidity, and they find themselves in less ventilated, close congregations and crowded people.
Well, I appreciate you speaking to us about this, Professor High Health CEO and health expert, Professor Ramneek Ahluwalia. Thank you so much for your time.